Hi, my name is Allison, and today I'm going to be focusing on the commercial sex trafficking of runaway and homeless females. So the definition of human trafficking is right here, but the three main elements of trafficking is the action, the means, and the purpose. So sex trafficking specifically, it must involve a commercial sex act in which something of perceived value is exchanged. So the vulnerable population I'll be focusing on is the runaway and homeless female population. So 55% of exploited victims are women and girls, and 26% are under the age of 17. So minus the runaway and homeless component, women, especially underage women, are at a greater risk of being human trafficked. The traffickers seek out the most vulnerable victims, so the supply is endless because countless numbers of girls are on the street, desperate for any economic opportunity, and this may lead them to be getting lured into trafficking. Extreme poverty tends to be the greatest factor to increase susceptibility of human trafficking. And some risk factors for this population may be a lack of education, a history of abuse or violence, and family instability. And these factors actually may have led these women to be on the streets as runaway and homeless. Some locations these victims may be found at include massage parlors, escort services, truck stops, and even just on the streets in general. Some tactics that traffickers may use include physical and emotional abuse, isolation from friends, and economic abuse. So here is the power and control wheel that we've talked about quite frequently in class. So these traffickers trap these victims into a fear of leaving, specifically due to psychological trauma, emotional attachment, and even physical threats. Traffickers find the opportunity for runaway and homeless females because they are the most vulnerable population. If they're homeless, they're just looking for that companionship or even an adult caregiver because these girls may have no connection with family and just want someone to take care of them. And they may be desperate to take any type of job or shelter, even if it puts them into dangerous situations. So these traffickers prey on these vulnerabilities and take control due to their insecurities and lack of resources. Some misconceptions for trafficking is that victims never know they're traffickers. Victims can be trafficked by anyone, including family, romantic partners, anyone they may know. If they're willingly participating initially, it is not human trafficking. This is a situation where someone may have started as a prostitute willingly for money, but cannot get out due to force, fraud, and coercion. So this is human trafficking. And then a few more include human trafficking as a violent crime, as well as human trafficking involves moving a person across state or international borders. Many traffickers use psychological abuse rather than physical abuse, and trafficking can be apparent in hometowns or even in our own neighborhoods. It does not have to be across state borders or international borders. Some health problems and risks that these patients may be coming in with include mental problems, including depression, anxiety, PTSD, substance abuse disorder, or suicidal ideation. And some physical health problems may include injuries that are not consistent with the reason of visit or just injuries in general. There may be frequent flyers. There might be dental infections, chronic pain, STIs, or even drug overdose. And this statistic is really significant. I feel that only 68% reported that they have seen a healthcare provider during their traffic period. So this is more than 50%. However, we still need to make sure that we're identifying these red flags and screening these victims as trafficking victims. And going into that, some identifiers for human and sex trafficking include an unstable living situation. So this is definitely prevalent in our population of runaway and homeless females. They may have previously experienced any forms of violence, such as sexual or domestic abuse. They may be runaway, facing poverty or economic need, or addicted to drugs and alcohol. Some situations that may raise concern for possible sex trafficking. They may be staying with someone who is not their parent or guardian. They may have an intimate relationship with someone only known on social media platforms, so they may be catfished. And they may show signs of abuse from a family member or partner that they are currently living with. And then someone who is sex trafficked may disclose that they were reluctant to engage in commercial sex, but someone pressured them to do it. They may live where they work and transported by guards. They may refer to a pimp or a manager. And they may work in an industry that may be common into performing sex acts for money. So like a strip club, a go-go bar, an illicit massage business, anything like that. Finally, with evaluation and management as healthcare professionals, we want to address acute illness and injury, but our primary goal is to create a safe haven from any trauma or exploitation and offer any available resources. So we want to address those social determinants, such as change around poverty, housing, food access, anything like that. And as nurses, we're mandated medical reporters for this population. So any person suffering from a wound or injury, we do have to report to the chief of police or head of the police force, even if there are suspicions, and we have to report it both in writing and verbally. Patients may come in with a flight, fight, or freeze reaction due to toxic stress, and they may come in with unexplained health conditions like physical abuse, dietary issues, GI conditions, anything in that sort. And then our management, we want that interdisciplinary approach, including social workers, law enforcement, case managers, and advocates. We want to provide services for housing, medical services, legal services, food. Just that multidisciplinary teamwork is crucial to this population. And nurses can develop and promote community level interventions. We don't want to promise our patients anything, but we want to make sure our patient priority is first because they dictate their bodies and they know they're expert in their own survival. For patients to accept, we want to make sure we provide them with a safety plan. But for patients who decline assistance, we want to make sure that we are here to help them at any time, whether that's providing a card or a return appointment. And then finally, here's some resources that we had. Of course, the National Human Trafficking Hotline Center. And the rest of these are Metro Detroit organizations, some for human trafficking and some specifically for sex trafficking. We had a few advocates in our panel come from Alternatives for Girls and Avalon, which is really awesome to hear, as well as Common Ground and Sanctum House. I actually currently volunteer at Haven through my sorority on campus. So I know quite a lot about them and they're a great organization. And then finally, Truckers Against Trafficking, we talked about this in class. This is a very prevalent organization for these runaway and homeless females. And then here is a list of our references. And I want to thank you for your time and listening to my presentation.